Okay, this first set of notes, we don't have a document to go by. This is just going to be a lecture, and this is how I always do it anyway. So you can kind of watch, pay attention to the board, which in this case I've got PowerPoints, which is what I would be showing on the board. So we need to get some definitions and some terms down to get you kind of familiar with what's going to be going on in this course. So these terms are ones that will crop up off and on during the course. The first one, you can see my little hand here, is called anatomy. Anatomy is the study of structures and the relationship among structures. Like we'll look at the skeletal system, look at the bones. We'll look at the muscular system, we'll look at the muscles. We'll look at the cardiovascular system, and we will look at blood vessels and the heart. Well, physiology is the study of the functions of the body, like how do muscles contract? How is blood formed? What's its function? What's the function of the valves in the heart? What's the function of the joints of these bones? So anatomy and physiology are two terms, just kind of get straight. This class covers them both at the same time. We don't have the first half of the class being just anatomy and the second half being just physiology. We cover them both at the same time. The anatomical position. Since the body is erect, that means standing up, the feet together, you can see they're together there at the bottom, palms are forward, they face forward, and the thumbs are pointed out to the side. This is the anatomical position. If a person is standing like this, but their hands are turned where their palms are toward the back, that is not the anatomical position. This is, the body is standing up, feet side by side, palms forward, and the thumbs out to the side. That's the anatomical position. Some more directional terms. This has orientation and directional terms. So we're going to look at the first one, first pair. They're all grouped, superior and inferior. Superior means above, inferior means below. And they're usually used in names of structures to say that one is above the other. So let's look at the heart here. And you see that the heart, there are two large blood vessels that I have with red boxes. Their names are circled with red boxes. The superior vena cava and the inferior vena cava. Let's look at what the superior vena cava does. The superior vena cava drains venous blood from the head and shoulders. So all the venous blood from your head and shoulders is going to drain into the heart by way of this upper vein. The inferior vena cava drains venous blood from the chest and the lower body. So all the blood from your chest and the lower body, like your legs and your torso, drain into the heart by way of this large vessel. Since these two vessels are draining blood into the heart, they're both having the same function, but one is above the other one. That's why the one on top is called the superior vena cava, and the one on bottom is the inferior vena cava. Let's look at the eye picture down here to the right. And there are 6 extrinsic eye muscles. Now I've only got 2 of them in red that we're looking at right now. The superior rectus on the top. Rectus means straight, and when that muscle contracts, it rolls the eyeball up, basically. And the inferior rectus on bottom, when it contracts, it basically rolls the eyeball down. So the superior is on top, the inferior is on bottom, and they're both straight muscles. Let's look at the picture on the bottom left, this person's face. Now we can use them for positioning on, a face. The nose is superior to the mouth. It's above the mouth. That's true. And the mouth is inferior to the nose. It's below the nose. So that's how you use the two terms, superior and inferior. Dorsal, ventral. Dorsal means the backside. Ventral means the belly surface. These words are always used together, dorsal and ventral. There's another set of words. Dorsal would be posterior, and anterior is ventral. But if you use dorsal and ventral, you use those two terms. Otherwise, you would use posterior and anterior. Now, looking at this man over here on the right side, you see that the front side of his body, I have the box there, is pointing anterior. And the back of his body, posterior. You could also say that the belly surface of this man is the ventral surface, and the back surface of this man is the posterior surface. One thing that you've seen this word before, one thing you don't want to see if you're floating around in the ocean is the dorsal fin of a shark. That's on his back. Now look at the pictures on the bottom left. These are cavities of the body, and they can be divided into the dorsal body cavity or the ventral body cavity. Let's look at the dorsal body cavity first. These are on the back side of the body, the dorsal surface, the back. So the dorsal body cavity can be subdivided into two cavities, the cranial cavity, which houses the brain, and the vertebral cavity, which houses the spinal cord. Well, let's look at the ventral body cavity on the front side. It can be divided into three major cavities. The thoracic cavity, which is your chest, the abdominal cavity, which is the soft part below the ribs, and then the pelvic cavity, which is the lowest. It means basin. The pelvic cavity contains things like rectum, the ovaries, the uterus, the prostate, the urinary bladders. They're all going to be in the pelvic cavity. The abdominal cavity is going to contain structures like your stomach, your large and small intestine, your liver, your pancreas, even your spleen is in this area. Now you look at the thoracic cavity, and it can be subdivided into three cavities. The ones that house the lungs are called pleural cavities. The pleural cavities house your lungs. In between the lungs is one called the mediastinum. And the heart cavity, that is called the pericardial cavity, is inside of that mediastinum. So you have three pleural cavities, two pleurals, one for each side. The pericardial cavity houses the heart. And the mediastinum is going to be where like your esophagus, your trachea, your aorta, your vena cava are going to be found in this area in the middle. Now the top left picture is a cross section of your spinal cord. And you can see that I have two arrows here. The top one is the dorsal root, so that tells you that's the back side, because the other arrow is pointing to the ventral root, that's on the front side. And this large structure here, which is not labeled, is called the dorsal root ganglion. It's a collection of cell bodies in this dorsal root, but it still has the term dorsal, so it's on the back side. Medial, lateral, another set of opposites. Let's look at the definitions. Medial equals toward the midline of the body. You have an imaginary midline that goes right down the middle of your body, between your eyes, down the middle of your nose, the middle of your mouth, right through between, in the middle of your chest, right through your belly button, all the way down. It's an imaginary line. Things that are close to that line are called medial, compared to other structures which are not close. Look at lateral, away from the midline, away from the middle of the body. So let's see how you can use this. Look at this, these two pictures over here, this boy and girl, and you can see that the nose is medial compared to the ears. The ears are further away from the midline, so they're lateral compared to the nose. The nose is medial, the ears are lateral. So it just depends on which way you compare them. The nose is medial to the ears, true. The ears are lateral to the nose, that's true also. If you look at the knee down here, this bone, the tibia, we'll see later, is called it's your shin bone, but we call it the tibia. Two lower leg bones, and the tibia is medial, the fibula is lateral in your lower leg. So you've heard of the meniscus before. It's a fibrocartilage pad between your femur and your tibia. Well, there are two big knuckle-like surfaces on your femur that will slide in these little dished out places of the meniscus so that you can bend your knee. Well, the part of the meniscus on the medial side is called the medial meniscus, closer to the midline. The part of the meniscus that's away from the midline is called the lateral meniscus. So you have the medial and lateral meniscus. So the terms medial and lateral are part of the name of that structure. When you look at this person's ankle, here's that shin bone, the tibia, that we saw over here on the right-hand side, and here's the fibula. Well, the inside bump on your ankle is called the medial malleolus. It's a type of a process called a styloid process, but it's got its own name. It's called a malleolus, and it's on the medial side, so it's the medial malleolus, compared to the bump on the outside of your ankle, which is called the lateral malleolus. It's the end of that bone, and that's the outside bump on your ankle. Okay, now we have some new terms, proximal and distal. Now, usually these are, most of the time we'll use these will be with relationships of the arms and legs to the torso, parts of the arms and legs compared to the torso, but we'll see that we can also use those in some other structures inside the body. So let's look at this, proximal, distal. Proximal, nearest the point of attachment of the limb or structure to the torso. Distal, farthest away from attachment, or the origin, the point of attachment to the torso. So let's look at the look on the left. The elbow is proximal to the fingers. Okay, the elbow is closer to the point of attachment up here in the shoulder than the fingers are. That's true. So the elbow is proximal to the fingers. Compared to the fingers, the elbow is closer to the point of attachment. Well, let's look at how the fingers are compared to the elbow. The fingers are further away from the point of attachment up here than the elbow is. So they're distal, further away compared to the elbow. So the fingers are distal to the elbow. Well, let's look at the leg. The knee is proximal to the ankle. So the knee is proximal compared to the ankle. It's closer to the point of attachment than the ankle is. All right, let's reverse that. What is the ankle compared to the knee? Well, the ankle is further away from the main point of attachment than the knee is, so the ankle is distal compared to the knee. Look at the bottom right. Here's a bone, and this is the upper arm bone here, and you see that it has a shaft. It's called the diaphysis. Diaphysis means between growth or through growth. And epiphysis means upon growth. And there are two epiphyses, the two ends of the bones, each one's called an epiphysis. Well, the one at the top is called the proximal epiphysis. This is part of the ball and socket of your shoulder up here, this little head of the humerus here. And so this is closer to the torso, closer to the point of attachment to the torso than your elbow is down here toward your elbow. So this is called the proximal epiphysis, this end of the bones, the proximal epiphysis. This is the distal epiphysis, further away. The shoulder area is closer than the elbow. Let's look at the bones of your wrist. These are called carpal bones, and there are two rows of four. One row of four is further away from the main point of attachment than the other row. So the row that's further away is called the distal row. The row that's closer is called the proximal row. Now when you get into the kidneys, we have some structures called nephrons in the kidneys. And the nephrons have some structures. They have a body portion and a tubular portion to a nephron. Up here is a capillary bed, and it's called the glomerulus, and it's surrounded by what's called the glomerular capsule. This is the renal corpuscle. It's the main portion of the nephron. Well, coming out of it is a tubule. Now you see that this tubule comes out of this glomerular capsule and it twists around a little bit. Then here's the loop of the nephron, and then it twists some more, and then it comes into a collecting duct or a collecting tubule. Well, this part of the tubule that twists here is called the proximal convoluted tubule. Convoluted means twisting. So it's the tubule that's closest to the glomerular capsule or the glomerulus than the other one. The other one's further down. It has to go past the loop of the nephron and back up, and then it twists again. That's the distal convoluted tubule. It's further away from the glomerulus. The one that's closest, proximal convoluted tubule. The one that's further away, distal convoluted tubule. Superficial and deep. We'll use these just a little bit, not a whole lot, but superficial says describe body organs according to the closeness to the body's surface. Superficial means closer to the surface than something else. Deep means further from the surface than something else. So when you look at these pictures down here, it says the lungs are deep to the rib cage. Yeah, they are deep because they're below the rib cage. So the rib cage is superficial compared to the lungs, and the lungs are deep compared to the rib cage. If you look at muscle here, it says this is an arm that's been cut. The skin is superficial to the muscle. Yes, the skin is on the surface. So yes, it is superficial to the muscle because the muscle's below it. The muscle is deep compared to the skin. Now, we won't use that one very much, but I'm not saying that we won't see it in some terms during the class. You may see it on one or two terms. Anterior and posterior, there they are. Anterior is the belly surface. Posterior is the back or dorsal surface. And I put some arrows by some words I want you to become familiar with right now. We're going to be learning a lot of new words in this class. Most of your science courses will be using Latin and Greek, and mostly Latin. And you'll probably notice that some of these words are the same in your native language if you're from another country, because Latin is the root language for all the languages. And so, you know, some easy ones on the left, like oral. You know, you heard of your oral cavity, where you take medications orally. That means you take them by mouth. Axillary, that's your armpit. And we'll find some axillary structures in this class, like axillary lymph nodes, axillary artery, axillary vein. So we're going to see some of those as we go through this course. Abdominal, structures that are in the abdomen, at that cavity, the abdominal cavity. Brachial, we'll look at the upper arm and we'll do some muscles, and they have that name in them, like triceps brachii, biceps brachii, brachioradialis. They're going to be using brachial for upper arm. Pelvic, this is your pelvic area where your hips are, basically. Digital, now digital will be one that will be used, but also we'll use phalanges. Phalanges are your fingers and your toes. Patellar, that's your knee. The patella is your kneecap. Frontal, this is your forehead, and the bone, we'll see when we get to the bones, the bone that's up here where your forehead is called the frontal bone. Sternum, this is the bone in the middle of the front of your chest, that hard bone there. Some people call it the breastbone, but it's called the sternum. It's made up of 3 bones. Thoracic, that's your chest. So we talked about the thoracic cavity is one of the ventral body cavities. Mammary, that's breast. You've heard of mammary glands, those are breasts. Umbilical, well, that's where your umbilical cord came out, and your belly button's called the umbilicus. Femoral, you have a long bone in here called the femur, And so this is the femoral part of your leg, named after that bone. Look on the other side. Here's brachial again, going to the upper arm. Yeah. Gluteal. Gluteal, this is called the gluteus maximus. You have a gluteus maximus and a gluteus minimus and a gluteus medius even. But it means your buttocks, your buns. And there's your femoral again for your thigh. So just look over some of those. That kind of gets you a little head start into some words. We're going to be building a nice vocabulary. And this is just a start to get you, into some of the words. And we have body planes or sections. And you see this girl here has these planes, which are imaginary layers or lines cut through the body. So let's read this little verbiage here. This slide shows how the body can be cut or sectioned to reveal different aspects of how the body systems are oriented or positioned in the body. Well, the planes are directions you can cut a body, okay? And sometimes we'll talk about a transverse section or a sagittal section or a coronal section. And so you need to know what that means. You look at the, let's go to the next slide. Yeah, here we go. When we look at the one right here, let's look at frontal first, the one on the left-hand side. Frontal or coronal. Now, coronal because that would go across the crown of your head. It's this one that divides the body into anterior and posterior portions or dorsal and ventral portions. So it says a plane that divides the body into anterior and posterior sections. So it would just divide the body into front and back sections. It's called a frontal or coronal plane. And let's look at the bottom right one, transverse plane. Transverse means across, so it goes across, and it can be anywhere, across the head, across the neck, across the shoulders, across the waist, across the bottom of your legs. So look at the definition, a plane that divides the body into superior and inferior parts. It's a cut that's roughly perpendicular to the long axis of the body. Your axis is like a tree, straight up and down. Anything perpendicular at a 90-degree angle across that axis is a transverse plane, a transverse section. Now a sagittal section, that's going to be what they call medial section. So a sagittal section or a sagittal plane, a plane which divides the body into left and right portions, left and right. Well, there's two types of sagittal sections. A mid-sagittal section divides the body into equal left and right portions. So it goes right down the middle of the body, between your eyes, down the middle of your nose, between your front teeth, right down the middle of your sternum, down your belly button, and you fall into equal left and right portions. That would be a mid-sagittal section. But what if it's off to the left or the right? It's called a parasagittal section. That cut or plane or section parallels the sagittal section, divides the body into unequal left and right portions. So it might be a cut that goes down, let's say, and divides right in the middle of your right eye all the way down. So you're going to fall into unequal left and right portions. Okay, so we had dorsal and ventral body cavities. So earlier we went through dorsal and ventral, and now this is pointing out the same thing again. The dorsal body cavity, the cavities on the back side of the body, and here's the cranial cavity and the vertebral cavity. Cranial cavity again is a cavity that contains the brain, and the vertebral cavity contains the spinal cord. Okay, so that's dorsal body cavities. Those are two dorsal body cavities. The ventral body cavities are on the front side. So you can see over here where my hand is, you can see that they're on the front side of the body from the side. Now you're looking straight on at the person's from the face, looking at his ventral surface here. You can see there's the thoracic cavity, the abdominal cavity, and the pelvic cavity. And again, the pelvic cavity, oh, there it is, contains the bladder, reproductive organs, and the rectum. So the ovaries are in here, the uterus is in there, the prostate is in there, and the rectum is in that area, and urinary bladders are in there. The abdominal cavity is going to contain things like your stomach, your large and small intestine, your liver, spleen, pancreas, they're all in there. Now the thoracic cavity in your chest, that's your thoracic cavity, right above your diaphragm, that can be divided into 3 subcavities. You see that here is the pleural cavity. Pleural means air. These are the cavities that contain your lungs. Between the lungs, there's a cavity called the mediastinum, right in the middle. And the mediastinum contains structures like your esophagus, your trachea, your aorta, your inferior vena cava, superior vena cava. They're going to be in here, coming off the heart. And then there's a pericardial cavity, which is between the lungs, and it takes up part of the mediastinum itself. And that contains your heart. So those are the body cavities, and they also use the terms dorsal and ventral. And I looks like I went ahead and expanded this a little bit on the dorsal body cavity again. Slide shows how the dorsal body cavity is divided into a cranial cavity, which covers the brain, or contains the brain, and the vertebral cavity, which contains the spinal cord. So these are just blow-ups of what we just saw, individual pictures of the dorsal body cavity and how it's subdivided into the cranial and the vertebral cavities and what they contain. And then here's the ventral body cavity, and I have all the verbiage over here that tells you what you can find in these cavities and how the thoracic can be divided into 3 more cavities, 3 smaller cavities. Some other ways that the body can be referenced is by quadrants. Now, quad means 4, right? And so the abdominal pelvic region can be divided into quadrants. And this horizontal line goes right down the midline between your belly button, which is roughly there, and across the top of your hips. And so you have 4 quadrants here. Now, one thing you have to pay attention to when you're looking at these quadrants is that your left is not that person's left. Your left is that person's right. So you have to describe the quadrants as that person's quadrants, not your left and right, but their left and right. So above, on the right-hand side, the right upper quadrant. So someone could say, I have a pain in the upper right quadrant. Well, that's kind of a generalized area, and you can be more specific with some other types of dividing the abdominal pelvic area, which we'll look at in just a minute. So there's the right upper quadrant, and there's the left upper quadrant. The right lower quadrant and the left lower quadrant. So you could have a pain in your left lower area of your abdominal pelvic region, and it's in that quadrant. So that's how this is divided. One way is quadrants. Well, you can get a little bit more specific. Body regions. And the way these lines are drawn is basically the horizontals go right up below the rib cage and right at the top of the hips. And the ones that are going up and down are just medial to the nipples. And so you end up getting 9 areas here, which are called regions. Now, let's look at some terms here, and I'll show you how this is not that hard to get down. Umbilical refers to the umbilicus, the navel or belly button area. This is also an area called your belly. Now, the word for belly is gastric. So when we talk about the belly as the soft part right in the middle, that's basically where your belly button is. We call that our belly, but that's the umbilical region. Okay, and you remember that the belly, the word gastric means belly. So If the area that has your belly button in it is the umbilical region because your umbilical cord came out of the umbilicus, the region above it is above the belly. So it's the epigastric region, upon or above the gastric, above the belly. Well, if that's the epigastric region, what does hypo mean? Hypo means below. It means less than or below, but in this case it's below the belly. So it's the hypogastric region, the pubic region. So those three really weren't that bad. Let's look at the iliac region. Let's look over here. Iliac refers to the iliac bone of the pelvis, the part of the bone that flares out on your sides of your hips. And you put your belt above it. The iliac bone is the one that wings out to the side there. So the one on the right side is called the right iliac region. And the one on the left side is the left iliac region, named after the bones. All right, you come up a little bit. Lumbar, the region of the back lying lateral to the lumbar vertebrae. Your low vertebrae are in this region in the back, your spinal cord or your vertebral column, vertebral column. And so the areas to the sides that are lateral to that are called the lumbar regions, named after the vertebrae, after the lumbar vertebrae. So this is the right lumbar region. This is the left lumbar region. And we have the last one, hypochondriac. We know psychology, hypochondriac, has a different definition than the anatomy and physiology definition of hypochondriac. Hypo means below, and chondro, look at what it means over here, means cartilage. So hypochondriac means the area below the cartilage of the ribs. When you feel your rib cage, this is not bone, this is cartilage. And so it is the area below the cartilage. That's what that word means. It feels nice and firm, and it is hard, but it's cartilage. And it's going to the ribs, which are going around the back. So cartilage attaches the ribs to your sternum. And so we'll see that when we get to the bones. So those body regions are not that hard to understand how they're named. Just have to know what the words mean, and it tells you everything you need to know. Serous membranes. Now this is an important one for you to remember, because we're going to be talking about serous membranes in most of the course. And these serous membranes are important. So let's look at what it says. The walls of the ventral body cavity, that's the inside walls, and the outer surfaces of the organs that the body cavity contains are covered with an exceedingly thin, that means very thin, double-layered membrane called the serosa or the serous membrane. Now it's very thin, okay? It has a fibrous sheet, and on that sheet is a single layer of some cells called simple squamous epithelium that we'll look at in the next chapter. And those cells that are very, very flat secrete a fluid which is like an oil. And here it is here. A thin lubricating fluid called serous fluid is secreted by both membranes. You say, what do you mean both? Well, these serous membranes, one form covers the organ itself, like the stomach or the intestine, large or small intestine, or let's say the liver or the pancreas, and the other is a wall around that organ, so they face each other. And we'll see that on a picture in just a minute. The part of the membrane lining the cavity walls is generally called the parietal serosa. Parietal means wall, so that's going to be the serous membrane that forms a sac or a wall around the organ. Not touching the organ, is forming the wall around the organ, or it's lining the wall around the organ. It folds in on itself to form the visceral serosa, covering the organs in the cavity. It's called the visceral. Visceral means organ. So when the serous membrane is covering the organ itself, it's on the surface of the organ, it's called visceral. Now, the name of the serosa, the serous membrane, is going to change accordingly to where it is, and we'll see that in just a moment. Here's an example. Now see what it says. This slide shows how the serous membrane can cover the organ and as the visceral layer of the serous membrane, and it also forms a wall or sac around the organ as the parietal. So what this is a balloon. That's the serous membrane, and they put their fist in here. The part of the serous membrane that covers the organ, the fist, that's the visceral part of the serous membrane. As it reflects back and forms a wall around that organ, that's the parietal layer of that serous membrane. So let's look at the heart here. Here's the heart. Now it has serous membrane on the surface. It is called visceral pericardium. The serous membrane around the heart is called pericardium. That's its name. Location, location, location. These serous membranes are going to be found in different areas. Parietal and visceral are standard. What changes is the name of the serous membrane according to where it is in the body. So pericardium means around the heart. So since this serous membrane is on the surface of the heart, it's called the visceral pericardium, just like on the surface of that hand. When it reflects and it forms the wall or the sac around the heart on the outside, it's the parietal pericardium, the wall around the heart. So the serous membrane's location is important. Parietal is the wall or sac. Visceral means it's on the surface of that organ. And then, like I told you, we're going to have three areas. So there are three different names for these serous membranes. The one around the heart, of course, is called pericardium. Well, let's look on the last slide and we'll see how the others are named. So I wrote this in red and black. The name of the serous membrane is determined by its location. If the serous membrane forms a wall or sac around the organ, it is the parietal layer of that serous membrane. If the serous membrane is on the surface of the organ, it's on the surface, it is the visceral layer of that serous membrane. So those are two important words, parietal and visceral. That tells you whether it's the wall around that organ or if it's on the organ itself. So, if the serous membrane surrounds the heart, it's called pericardium, around the heart. Peri, around, cardium, heart. If the serous membrane surrounds the lungs, it's called pleura. Parietal pleura would be the walls around the lungs, and visceral pleura is a serous membrane on the surface of the lungs themselves. If the serous membrane surrounds the abdominal organs, so the serous membrane of the abdomen, is called peritoneum. So the wall of your abdominal cavity is called the parietal pericardium. Parietal peritoneum, And when that reflects back over the organs, whether it's the stomach or the small intestine, the large intestine, or the liver, that's going to be the visceral peritoneum. So this is something you want to try to remember real well as you can, the difference between parietal and visceral, as well as location, location, location. Around the heart, pericardium, around the lungs, pleura, and anything in the abdomen, peritoneum. If it's forming a wall around those organs, it's the parietal, and then the name of the serous membrane. If it's on the organ itself, whether it's the lungs, the heart, the stomach, it's visceral, whatever. Visceral on the heart, visceral pericardium. On the lungs themselves, visceral pleura. On the stomach, visceral peritoneum. Okay, so go over these terms and get ready for another chapter.